So, dude, did you see the news this weekend with Biden, the stage 4 cancer?
Stupid question. Yes.
Yeah.
Of course
What
I
are your
did.
thoughts? What are your thoughts?
Well,
Like, how
so
could this?
it's
How
funny.
how could it happen? I don't understand. Like, everyone I know gets a yearly PSA, right? So there's no way he all of a sudden has stage 4. Like, it makes the only plausible thing is he didn't get a PSA.
Right. I watch all the channels, everything, some of the ones that you don't watch. But they've had on pundits this morning, doctors, not one urologist who I've seen. So it's funny. You have a pulmonologist who's telling you what he thinks.
Right.
Remember, we talked about guidelines, and I said one of the biggest things that pisses me off is they say don't do it over 70 unless you plan on living greater than 10 to 15
Yeah,
years.
I
That's the
know.
U.S. Preventive Task Force. And it's like, okay, when you're 70, do you sit there and say, whoa, shit, I hope I live more than 10 or 15 years, so I should have a PSA level?
It makes no sense because, okay, if you're saying the average age of a man in the U.S. lives to 74, so is
No,
that
it's 78.
okay?
78.
All right, fine, 78. So is that an insurance company thing? Insurance
Yes.
companies like, okay, so the insurance
That's what
company,
that's how that's what dude, that's what Gary Brecka does when he does his longevity. Because remember, his job was when he worked for insurance,
correct,
he was in the actuarial. So when he told, for example, Dana White, oh, you only have X amount of time to live, and Dana White's like, oh my God, this guy's a freaking wizard, or whatever they're
right,
called.
right.
It's because he looked at the statistics.
So the insurance company, which is another reason why people hate insurance companies, is they're saying we're not going to cover it if you're over 70. And the guidelines are like if you're over 70, you don't need a PSA. So Biden is what, 81? The only
82. But remember, he was
82.
president. He got elected when he was 78.
Yeah, so it makes no sense to me. So are we thinking that they didn't do it? Because all the conspiracy theorists are saying they knew, they had to know,
Wait, they're already
which makes
starting.
sense. Right. But
Right.
it does make sense. How do they not know a president, a stage 4? It's already spread. I don't get it.
Well, we'll get to that one second. But what's killing me is now everybody's like, that's why his thinking changed and everything. And I'm like, no, he doesn't have brain metastasis. Okay. Like
Right.
the conspiracy theorists are going wild. Like, oh, they purposely withheld this. So to me, the only logical explanation is that since, remember, like, he has military doctors, and if they're following the U.S. Preventative Task Force guidelines, really they didn't do it after 70. Okay, that would
Which is
be
kind of wild. We said last time it's $2.
right. And like that
$2
paper
blood
that I
test.
wrote on Substack that made me so angry, it's like the U.S. Preventative Task Force, who sets the guidelines. Now the American Urologic Association fights with them, but they testify before Congress, and that's where the insurance companies and Medicare establish their guidelines. They're saying 70 years old. And to me, exactly what you said, it's a $4 test. Why wouldn't you get it every single year? Like, why?
It's hard for me to believe he didn't have it, but that's the only explanation is that they stopped doing it.
But even, okay, so let's say they did it at 78 or 80. Is it possible that he had a normal PSA and he
A
had
year ago?
prostate cancer?
Yes. A
Yes,
year
there's always
ago?
exceptions. And if he has a Gleason's 9, so Gleason's score goes up to 10, and it's two numbers. It's measured the two biopsies where the densest part of the tumor is. So 9 and 10 are very aggressive. But with every cancer, there's people who are
Yeah,
stage
but
4 that
this
are
is a
dead in
slow.
9 months, and then there's people who are dead in 5 years. I mean, it's possible, but the logical thing is that he didn't have it recently.
Prostate is a slow growing tumor, so it's probably been in there for a couple of years, I would think. But
Prostate?
you're right. Maybe prostate's a slower growing tumor usually.
Yeah, but
So
this is this
maybe at
is a
80 is like you said, maybe he turned 80 and they said, we're not going to do it anymore.
right. Or they said to him, you know, here's the risks, here's the benefits, but you would still think if his PSA was elevated, they would have done a prostate MRI and they would have picked it up. And then there could have been decision making at that point. There's a lot we don't know. If they did an MRI and they saw a tumor there, they might have said, Mr. President, there's a chance you have prostate cancer. You probably do. Hypothetically, you're 80 years old. The chances of you dying from it are slim and none. That's why I'm not one of those guys that likes to do that watchful waiting,
Yeah.
because we don't know. Everyone behaves differently.
Well, it's all
So,
speculation. We're not going to know. But the
yeah,
bottom line is that, guys, please get your PSA checked. Simple blood test. Get it done every year, even if you pay
yeah,
out of pocket. Hopefully you don't, but even if you pay out of pocket, a few bucks, it's
yeah,
worth it.
yeah.
And look at our podcast we did on this, YouTube and Spotify if you want to listen.
If you don't get it done, you don't know.
Correct. So get your PSA done, please.
Right.